Alrighty, everyone, we're going to go ahead and get started. You might be wondering who I am, so I'll go ahead and introduce myself first. So my name is Amelia Jimenez. I am the Senior Marketing and Communications Specialist with United Urology Group, and I'm here to introduce to you our host for today, Dan Silver. And so today we're going to talk about understanding erectile dysfunction, causes, and treatments. There we go. Dan, do you want to go ahead and take it away? Talk about yourself?
Yep. Thank you all. Thank you all for joining us tonight. This is probably my most favorite subject to talk about. Those of you who see me know I'm extremely passionate about treating erectile dysfunction. Those of you who don't know me, I work primarily out of the perimeter office. I have background in internal medicine. I've been with Arizona Urology Specialists for about 17 years, and most of it has been doing men's health, erectile dysfunction, Peyronie's disease, and low testosterone. I've done this a long, long time. I've seen treatments come and go. I've pretty much seen everything that we can see in regards to erectile dysfunction. Um, Over the years, I've got nicknames such as ED Fixer, the Penis Whisperer, the CEO, the Chief Erection Officer. My main goal here is to go through what is erectile dysfunction and basically how we can treat it. When people come see me, I always say, listen, I can get you an erection. It's just how we're going to do it. And we go through all the options. We work together. We're a team. If I can't help your erectile dysfunction, I take it personally. I really do. I think that I should be able to get anyone who wants an erection, an erection. Go ahead, next slide. So what is erectile dysfunction? Basically, it's the inability to either get an erection or get an erection unable to maintain that erection long enough to complete sexual intercourse and to have a satisfying sexual experience, because who cares if you can get a good erection and you can maintain it, but you're just not lasting long enough, or the erection's not maintained. So all that stuff comes into play. The other thing with erectile dysfunction is it could be a sign of underlying health issues that maybe are undiagnosed. If you haven't seen your primary care in a while, maybe you have diabetes, maybe there's low testosterone, maybe there's a heart condition that you don't know about. So it's always important to see your primary doctor to make sure there's nothing else going on. I'm not the primary doctor. I can treat urology stuff, and I can recommend you see a cardiologist or see your primary, but I can't treat those things. So it's always important to make sure you're getting yearly physicals to make sure everything else is okay, to look for these underlying causes. They say it's estimated that ED affects about 1 in 10 guys at some point in their life. It's more than that. It really is. I see so much erectile dysfunction. I see it in people starting in their 20s, all the way up to I have guys who are 100 years old who I'm treating erectile dysfunction. It really is not a normal part of aging. We shouldn't expect to have erectile dysfunction. Again, there are urology patients I see for other things that are in their 80s, and I say, hey, how are your erections? Fine. And they're 85 years old. So, the goal is to figure out if we can figure out why you're having erectile dysfunction, and then aim our treatment at that. And basically, it's one of two things. It's either you have, well, it could be three things actually. You could have decreased blood flow to the main one. There could be something neurologic, or it could be psychogenic, where it's basically in your head for part of it. So we got to kind of figure out what's going on and aim treatment at that. Go ahead, next slide. So what happens when we get an erection? What should happen? Well, first of all, you have to have arousal. Well, when we were 16, early 20s, we can get arousal with a strong wind. As we get older, it takes more for us to become aroused. We need some sort of stimulation. When we become stimulated, the nerves around the penis become activated. So you have to have good nerves. The muscles relax, and then blood is supposed to flow into the penis. When blood flows into the penis, these corporal bodies, these two bodies up at the top there, it'll cause the penis to get rigid. When that rigidity occurs, it should put pressure on that little blue piece up there, the dorsal penis vein, to stop blood from coming back out. That's why sometimes you can get a good erection, but you can't maintain it, because either there's not enough blood in there, that dorsal penis vein is weak, and we call that a venous leak, and we have treatment aimed at that. So all these things have to do, you have to have good nerves, and you have to have good blood flow and sufficient blood flow to stop that venous leak. Go ahead, next slide. So what are some common causes? Diabetes is huge. At least 50% of the diabetics have some form of erectile dysfunction. What is that? Well, when sugars get high, it affects blood vessels, it affects nerves. That's why you see diabetics have problems with their vision. They get amputations because they're having poor blood flow to their lower extremities. I've even seen some bad diabetics who have such poor blood flow to the penis that it becomes necrotic or dead, and they have to have a partial penectomy or a penectomy. So it's really, really, really important, if you have diabetes, to keep blood sugars under good control. That includes taking medication properly and watching your diet. You guys have, when guys come see me and they start talking about their diabetes, they say, listen, I know you want to eat a piece of cake, but your penis does not want a piece of cake. Your penis wants a salad, okay? You need to eat healthy. Whenever you think about having that piece of cake or that giant bowl of Bluebell ice cream, eat something different. Eat something healthy. Think about your penis. And that goes along with cardiovascular diseases. You know, if you've had a heart attack or a stroke or carotid artery stenosis, if you have plaque build up in the vessels in your heart, you most likely have plaque build up in the vessels of your penis as well. The penile vessels are about 50% smaller than the coronary artery vessels, so it just goes without saying. Now, that's why when I see someone younger come in who is having new onset erectile dysfunction, I say, you need to go see a cardiologist to make sure there's nothing going on with your heart. Because if it's affecting your penis, it could be affecting your heart too. And all the stuff we go through with diet and exercise for erectile dysfunction is the same thing that's a heart healthy diet. When we look at trauma, you know, you could have a straddle injury. You could have racked yourself on a bike at some point, and that could have caused some nerve damage. Surgeries, especially the guys who have had prostatectomies. Most of the surgeons now are doing robotic nerve sparing procedures. But even then, even with a nerve sparing procedure, you still could suffer some erectile dysfunction. I tell you guys, it could take up to 2 years to get their erections back after a prostatectomy. That's why it's so important to do penile rehab after prostate surgery, such as using a vacuum pump every day, using daily Cialis, just getting blood flow into the penis. Because if you don't use it, the penis will shrink down, and no one likes a shortened penis. It can be like a frightened turtle. So, you know, penile rehab is a big thing for guys after prostatectomy. But it's not a death sentence for your penis to have a prostatectomy. At least you don't have cancer anymore. I can get you an erection. That's why some guys are so hesitant to have any prostate surgery. I don't want to have an erectile dysfunction. Listen, we can treat that. It's okay. Neurological disorders, especially the quadriplegics, have erectile dysfunction. Again, easy to treat. I can fix that. Medications are a big one. So when someone comes in with erectile dysfunction, I look at their med list. And if I see someone on a beta blocker for their heart, that's a big cause of erectile dysfunction. It doesn't mean I take you off of your beta blocker. It means I say, maybe talk to your cardiologist and maybe there's a different one they can give you instead. that doesn't affect erections so much. Other medications would be pain medications, narcotics, antidepressants are a big one to cause problem with erections, in addition to problems achieving an orgasm. Hormonal issues, specifically testosterone. Now, that one, people think that low testosterone is always the cause of their erectile dysfunction, which is not true. Testosterone only affects erections about 17, 18% of the time. Because again, remember, erections is mainly a blood flow issue. It doesn't have anything to do with testosterone. What testosterone will affect is your libido. Do you want to have sex? It may affect energy levels, muscle mass, weight, those types of things. But I will not use testosterone to treat erectile dysfunction. There are much safer treatments out there. I mean, there are risks to testosterone. It can thicken the blood, causing strokes, heart attacks. It can raise blood pressure. It can worsen sleep apnea. If you have underlying prostate cancer, it can make it grow. So again, testosterone is not the answer for erectile dysfunction in most patients. Sleep apnea is another one, kind of indirectly, because with sleep apnea, you're not getting adequate rest. Your body is not getting the rest that it needs. So in turn, it will cause fatigue. And if you're fatigued, that's going to affect your ability to get an erection because you're just tired. And I see this with people who are stressed, who are tired. They just don't get great erections because they're just not there. In addition, sleep apnea can raise your blood pressure. It doesn't want you won't exercise just because you're so fatigued. So someone who snores, I ask, do you snore? Do you have daytime fatigue? I look at them. Usually people with sleep apnea have a 17-inch neck or greater. If all those things are there, I say, you know what, you should go get checked for sleep apnea to see if that's part of the issue here. Go ahead, next slide. So there is a big psychological component or impact to having erectile dysfunction. We're guys. We want erections. I mean, and we don't get erections even one time. It's going to cause some anxiety and depression. And the problem with that is those same chemicals that are released when you are anxious are the same chemicals used to bring down an erection after you have an orgasm. So if you're worried about, am I able to get a good erection? Am I going to disappoint my partner? You're already 2 steps behind because you're releasing those chemicals and you're just doing yourself a disservice. So people say, well, maybe I should go on an antidepressant. Well, the problem with that is you go on an antidepressant and it's going to make your erections worse too. So it's a double-edged sword. Sometimes working with a sex therapist with these type of things will help. But mainly it's working with me so I can get you a good erection to get your confidence back. Once you get your confidence back, many times the erections will improve as well too. People have low self-esteem. They think their partner is mad at them, or their partner thinks that you don't love them because you're not able to get a good erection. So it starts affecting relationships and marriages. And it's important for your partner to understand that, this is a medical condition. It's not that you don't love them. It's not that you don't care for them. It's that, you have a medical condition and you're going to work on treatment. So it's always encouraging to bring your spouse, your partner to the appointment so they understand what's going on. And it's not that you don't love them. It's that we just need some help. And having a supportive partner is huge in this. If your partner is badgering you continuously, it's just going to make things worse. So we got to find ways around that. And all that is going to cause, obviously, a decrease in quality of life. Again, we're guys. We're used to having erections. It's part of kind of who we are, our manhood. And if it doesn't happen, we take it personally. And again, people can withdraw from their partners. Go ahead and hit the next slide. So this is kind of what I talked about before, is heart disease and erectile dysfunction. If you look at the different types of artery diameters, the penile artery is much smaller than any of the other arteries, your femoral, your carotid, or the artery supplying your heart. So again, if you've had a ischemic stroke, if you've had a heart attack, if you have peripheral artery disease, it makes sense why you have erectile dysfunction. So we got to find ways to get more blood flow into the penis. Go ahead and hit the next slide. So let's talk about different treatment options for ED. And there's many, but always the first thing we want to look at is changing lifestyle if we can. If you smoke, you got to quit smoking. Before you put that cigarette in your mouth, think about your penis. This is not good for my penis. If you have excess weight, especially excess belly fat, you got to work on that. The only way to really work on that is diet, taking less calories in than you need, really, a calorie deficit, increasing physical activity, cardiovascular exercise, 20 minutes daily will help. And so I've seen it many, many times where if a guy loses 10% of their body weight, their erections improve. It's proven. I've had people who have had bariatric surgery. They're on injections for their penis. After they lost the weight, their erections were great. So again, it's important to keep yourself healthy. If it is something that's more between the ears, where it's more in the mind, and I can't help that, seeing a sex therapist is always a good option, not only for yourself, but also for your partner as well. And it's hard to find a good sex therapist. You can't just go on like Craigslist because there's some pokey people out there. But I mean, there are like Scottsdale Center for Sexual Medicine is a good place to go. Um, they're out there. It's just you got to find one that's vetted, really. So bottom line is, first thing, get healthy, as healthy as you can. Go ahead, next slide. So we always think about medications as an option for treatment. There are about 5 different medications that we can use. We all know Viagra. The generic name for Viagra is sildenafil citrate. Viagra comes in 20 milligrams, it comes in 50 milligrams, and it comes in 100 milligrams. When you take a Viagra, you take it at least an hour before intercourse on an empty stomach. Very, very, very important. These things are taken on an empty stomach. It's either got to be an hour before you eat or 2 hours after you eat. Because if you take it with food or alcohol, you might as well throw it in the trash. And I see that quite a bit where people come in, they're taking I've taken all these pills, nothing works. Did you take it on an empty stomach? Well, no one ever told me. Well, there you go. And then they do it on an empty stomach and things are great. So Viagra, once you take it, you have about a 6 to 8 hour window to have intercourse. So it's more of a shorter acting. There is also Levitra, which is vardenafil, which comes in 10s and 20s. And that is very similar to Viagra, where it's got to be taken on an empty stomach. You have about a 6 to 8 hour window to have intercourse. Then we have Cialis. Cialis goes by tadalafil is the other name. Comes in a couple different forms. One is the daily Cialis, where you just take one a day, every day, and then hopefully you're ready whenever. I like that because it takes some of the stress out of I have to plan, okay? But it's a daily pill. They also make a tadalafil 10 or 20 milligrams, which again has to be taken on an empty stomach. But that stays in your system for 36 hours. So if you take it on a Friday morning, you're pretty much good for the weekend. But if you were to get side effects, you may have side effects for longer. One of the benefits of the daily pill is it's also approved to help guys urinate better. So if someone has problems urinating and they have erectile dysfunction, I like the daily Cialis for that. I've also had people take the daily Cialis, and then on the day they want to have intercourse, take an extra 2 or 3 of them on an empty stomach and see how that works. So there's a lot of different ways to adjust things with that. It's just talking to the patient and knowing what's going on. There is one called Stendra. Stendra is the newest ED drug out. I say it's the newest because I think it's come out since then. It's probably been out like 8 years now. Stendra is very, very expensive. I've seen anywhere from $17 to $25 a pill, which is higher than the $40 a pill it was a couple of years ago. But the difference with Stendra is that it doesn't matter if you eat or drink with it. So if you're going out and you want to have a big meal, you can take it and you're fine. You can also have up to 2 alcoholic drinks with it. So Stendra is one where maybe you're going off your anniversary, you don't want to have to worry about it. It may be a good option for you. Now, all of these pills are designed to bring blood flow to the penis. They work systemically. What are the advantages? Typically, they're easy to use other than you got to plan around meals. It's more natural. You're not having to pump your penis up. You're not having to give yourself an injection. You know, you're not going to have surgery. But if the pills work for everyone, that's all we would have. So disadvantages, it could take some time to work. Of course, you have, with all these things, except for an implant, you need some physical and mental arousal. You can't just take it and go watch TV. The expensive, not so much anymore. Stendra is the most expensive, but like Viagra, Cialis, especially you go to like Fry's, Safeway, Costco, use the GoodRx card. It's like 50 cents a pill, and for 90 of the daily Cialis, I've seen $30. So it's really not that bad. And then if you have, heart condition, especially if you're on nitroglycerin or isosorbide, they're contraindicated with that. So if someone has had a recent heart attack, or I say, you need clearance from the cardiologist before I prescribe this stuff to you. And then, of course, there's always potential side effects. Headache, upset stomach, flushing is a big one I see, nasal congestion. Back pain is really only with Cialis. About 5% of people get back pain with Cialis, and we don't know why. Vision changes, usually only see that with Viagra, or blue tinting to the vision, pink tinting to the vision. As a matter of fact, when it first came out, pilots couldn't take it because apparently they could miss the runway at night if, when they were trying to land. So they weren't allowed to take it, but I think that's now changed. And then prolonged erections. I can tell you what, in all years I've done this, I've never seen a prolonged erection with any of the pills. It just doesn't happen. Other treatments, yes, but not the pills. I wouldn't worry about that. So pills are kind of my first choice in treating people, unless there's some contraindication to it. And we would have a discussion on, are things more planned? Do you want things to not be as planned? And do you have problems urinating? So it's really individualized per the person to which pill I typically prescribe for them. Go ahead, next slide. So the other treatment option is a vacuum pump. You could see here it's just a cylinder that you put over your penis. You either push a button or you pump a handle, and it creates a vacuum suction and pulls blood into your penis. And then you slide a ring over the base of the penis to hold the blood in. It's a good option. It's a little hokey. Takes a little bit to get used to. I would say if you're dating, you probably don't want to use this. Get this thing out. You're going to scare someone away. But, if you're married, who cares? You can use it as far as foreplay, really. The thing is using it correctly. When I prescribe this for someone, I tell them you need to A, read the directions, and B, practice for 2 weeks. Get good at pumping. Get good at putting the ring on. Just get comfortable with it, because you don't just want to start using it, become frustrated when you're trying to have intercourse. You're going to throw the thing out the window or sell it on eBay. So get good at using it before you try to use it for intercourse. They run around a good pump is around $300. You can get them on Amazon for cheaper. You can get them at the fascinations or sex stores for cheaper, but they're just that. They're cheap. The suction isn't good. The rings aren't good. You want a good pump. And I can tell you insurances don't pay for these, but you pay $300. Once you have it, you have it. It's reusable. You can use it whenever you want. It's easy to travel with. It works quickly. It takes about 5 to 10 minutes to really pump it up to get a good erection. And again, no surgery. You don't have to inject your penis. Really no side effects to it unless you pump too quickly. You may have some pain or bruising from the pumping. Cons, it's not spontaneous, obviously. You got to get this thing out, put it together, and pump your penis up. Some people don't pump it enough, so their penis is kind of floppy. But theoretically, if the ring is too tight, it could affect ejaculation, although if the ring is too tight, it's going to be painful. You're going to take it off and find a different ring. So I really don't see that too much with it. These are really good for people post-prostatectomy, for penile rehab, just getting blood flow into the penis. I love vacuum pumps for that. And this is something that, if you see me, I write a prescription for it. We send it in, they ship it to you. Go ahead. Next slide. Injection therapy. I teach a lot of guys to do injections, and it sounds really, really scary, but it's not that bad. It really isn't. Of all the years I've done this, I probably teach 5 to 10 guys a week to do it. No one runs out screaming or passing out. Basically, what this is a mixture of 1, 2, or 3 different medications that are all designed to bring blood to the penis to create an erection. The tiny little needle. I teach you to do it. You come in the office, you bring all this stuff. We do an injection here in the office, and we see how you respond. Based off that response, I tell you how to go up on the dosing. I said there's one agent, 2 agent, or 3 agents. I always start with what's called trimix, which is 3 different medications: phentolamine, papaverine, and prostaglandin, because I think that's the most effective. They also make a quad mix, which I don't think is as effective because the strengths are typically lower in all 4 of them. But the shot goes into the side of the penis, and you do it about 10 to 15 minutes before you want to have intercourse. It's stored in the refrigerator, so it's a little hard to travel with, but you could do it. You get an insulin carrying case. You can't get this at like Walgreens or CVS. This is made at a compounding pharmacy, and there's a bunch of different ones. I have one that I've used for many years because they have about 10 different strengths, and I say the strengths are from low octane to jet fuel. I always start people kind of in the middle, because the risk is if you use too much of the medication, you'll end up in the ER with a prolonged erection, which is not fun. We have to stick big needles in the penis to suck out the blood. It's just not a good thing. So we start low and we work our way up. So when you come in the office for this, I say, don't expect miracles. Don't expect miracles here in the office. A, we're starting low. B, there's not a lot of stimulation in the office. It's just not the most stimulating place. But once I see how you respond, I can tell you how to go up on the dosing. Cost-wise on this, it's about $170 every 3, 4, 5, 6 months, just depending how often you use it. What are the pros? It's rather quick. So if you inject, that's when you have foreplay. So it kind of incorporates that into your lovemaking. You last about an hour. That's what you want it to last for. I tell people once you find the dose where you can get an erection, have intercourse, and it goes away within an hour, that's the right dose. It's more natural feeling. And again, no surgery. Costly if not insured. Well, I've never seen insurance cover this. And like I said, it's about $170 every 3, 4, 5 months. There's occasional where you can get some bleeding at the injection site. No big deal. You'll get a bruise. It'll go away. Theoretically, if you inject a needle into something enough times, you can develop scarring. and you can develop a curve to your penis. Very, very, very rare. Then there is the risk of a prolonged erection. We talked about that. And, if you get that prolonged erection and we can't get it down, sometimes we have to do surgery to take it down, and that can further cause damage to your penis and erectile dysfunction. So when you're using this, we got to be very careful about finding the right dose. You know how many times we've been called to the ER because someone has used their friend's trimix and that dose wasn't right for them, and they ended up having to go to the OR because of it. So don't ever borrow your friend's trimix, and don't share it with your friends. I can tell you that. Next slide. There is intraurethral suppositories where it's either a pellet or a gel that you can stick in your urethra or your pee hole. I've been using this more and more lately because they make a trimix intraurethral gel that if someone is deathly afraid of needles, I'm sometimes finding that the combination of daily Cialis and the intraurethral gel has worked for some people. It comes in different strengths. I always go to the highest strength and see how it works. It's a needle-free option. Again, works in about 10 minutes. It's easy to travel with. So if someone's traveling, it may be a good option for them. It's never covered by insurance. And typically I found it's about $13 to $15 a dose. And it definitely is not as effective as the needle therapy, or the trimix with the needle. I still have people take their PD5 inhibitor, their Viagra, their Cialis with it to potentiate the effects of it. It may cause some burning in the urethra or burning after you urinate. Spontaneity, it's pretty quick to do. It really shouldn't affect spontaneity any more than the injection would. And there's always potential for risk of the medication transfer to the partner, although I don't think it would do anything to your partner, and I've never seen it happen. But I guess the risk is there for that. So out of all the things I use, probably intraurethral gel is probably the least I use of things, but I do have it in my armamentarium to use if needed. Next slide. And then there's the old penile implant. So penile implant to me is one of the last resorts for erectile dysfunction. We've tried other things. It just doesn't work. Penile implants are basically cylinders that go in the penis. There is a reservoir that goes in your abdomen, and there is a pump that sits in your scrotum. Basically, it's like a third testicle, basically. It's an outpatient surgery. Takes about an hour and a half to 2 hours to do. At each of our offices, we have the different surgeons that are good at doing these, that do a lot of them. What are the benefits of it? Well, basically, you don't need to take a pill. You don't need to get a shot. And you can just, whenever you want, pump your penis up and have intercourse. When you're done, you press the button, it goes away. They also make a semi-rigid implant, which no one really uses anymore. And basically, that's what we call a malleable, where it goes in your penis. There's no pump. It's always kind of stays erect, and you can just bend it any way you want. Not a good thing if you're going to like a beach with a Speedo on. Probably not a good thing. So we really don't use those anymore. But the 3-piece inflatable is the most commonly used. You really don't see it. You would feel it if someone were to feel your penis, but when it's flaccid, but when it's rigid, it's just like a regular erection. It's not going to make your penis any longer or any shorter. Your penis will be the penis length because they measure it at the right length. The other thing about this is typically covered by insurance, which is very funny to me, that they'll cover a $10,000 surgery, but yet not cover Viagra, 50 cents. So, it's an option. And that's what I say. We can always get you an erection. If worse comes to worse, I'll send you over to one of the surgeons, and they'll do an implant for you, and you'll get your sexual life back. So not a bad option. Next slide. basically the satisfaction of penile implants is pretty darn high because it's an easy way to get an erection. Now, with the surgery, you leave with the catheter for a day and sometimes a drain. You come out the next day, you're sore for a couple weeks. But, it's a couple weeks. So think about it. After a couple weeks, you're not sore. You come back 6 weeks, we teach you to use it, and you're good to go for the next 20 years. And how long does it last? Yeah, it could be 20 years. Depends how often you use it. There are movie stars that have this who use it many, 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 many times a week, and they wear out after 2 or 3 years. It's just, again, it's wear and tear on the thing. But bottom line is most people are satisfied with it. Next slide. The final thing is low intensity shockwave therapy. This has been done in Europe for over 30 years now. I've been doing it for about 8 years. I've treated over 600 guys now with it. What it is electrohydraulic waves that go into the penis that helps regenerate blood vessels, erectile tissue, get it to where the pills will work for you. It doesn't get you off of the medication. It makes it to where the pills will work for you. You come in once a week for 6 weeks. It's totally painless. There's no side effects to it. There's no risk to it. You come in, it takes me 10 minutes, and you just lay there. Now, usually you don't see results till maybe treatment 2 or 3. And typically what I hear is I feel more fullness and more sensitivity to my penis. After that, things just kind of build. You don't see max results for anywhere between 6 weeks to 3 months with it because tissue has to build up, has to regenerate, has to repair itself. The benefits of this is you don't need a needle. You don't need a pump. It's non-invasive. Like I said, it takes me between 10 and 20 minutes to do it. Effectiveness, after seeing all the studies and doing my own treatment of over 600 guys, it's honestly about a 70% success rate. If anyone tells you any different, you go to other clinics with, 90%, you're going to get an erection. It's a lie. It isn't. It's really about a 70% success rate. But it's safe. There's no risk to it, and there really is no discomfort to it. Go ahead, next slide. The biggest thing with this is never covered by insurance and by far the most expensive treatment. You could pay anywhere. We charge $2,750 for 6 treatments. I've seen some clinics charge $6,000 or $7,000 for these treatments. So it's by far the most expensive, but least invasive with this. This is not going to work for someone who had a prostatectomy and it's nerve damage. This doesn't fix nerves. It helps with blood flow. So if someone comes in, they've had a prostatectomy and they're having great erections before the prostatectomy, now they're not having great erections, well, that's probably a nerve problem. I don't recommend this for them. I recommend it for someone who just needs a little boost. The pills are almost working for you. Well, this may be a good option for you. Go ahead, next slide. Should be. So with that, I will take any questions that you have. I'm happy to answer what I can for you. If you need to see me, there's my number. You could always come and see me. I'm happy to help you.